Hi, okay, my name is Kenneth Mototwa, a physiotherapy fourth year student. Alright, so I'm going to be presenting on the physiology of aging on special senses specifically. Okay, so these special senses are the senses that have specialized organs devoted to them. Special senses which will include the hearing and the balance, which is the auditory system and the vestibular system. And there's a sight and there's a vision also. There's a smell, okay? Smell, of course, is in the tongue, right? Most obvious. Taste using the tongue, touch, vibration, and pain. So I'll be a little quick due to time. I have a lot of things to present. So we experience the environment around us through our spatial senses. So neurons relay this information via the central nervous system to the brain. If the central nervous system of a brain deteriorates as a result of age or illness, then this flows of sensory information can also deteriorate. Okay, so changes to the sensory system. Okay, as we age, our sensory function decline to contribute to increased isolation from the outside world, forcing us to adopt perceptual aids, e.g., glasses, hearing aids. This has been demonstrated, especially for hearing and for the vision. We all see these things, putting on the specs. Most obvious. Okay. Then also, hearing is a well-known to decline with age and is usually characterized by decreased hearing sensitivity. Okay, so there might be a lot of noise, but the person you have to speak, with a loud voice for a person to hear you. Impaired sensory function impacts the quality of life of other people, influencing the way they experience the environment and react to stimuli and limit social activities. May lead to isolation and also depression. Okay, sensory deficiency has also negatively consequently for somatic health. Okay, e.g., vision loss, increase the risk of falls, fracture, all these things. So special senses has stated, before there can be eyesight, okay, and hearing problems. So the effects of aging on the taste, gastro dysfunction may be related to the normal aging process. Okay, other than smell dysfunction, the most frequent cases of taste dysfunction are prior upper respiratory infection, head injury, drug use, and idiopathic causes. So chewing problem associated with tooth loss and dentures can also interfere with the taste sensations. Okay, so people who have taste disorder may benefit from flavor enhancement of their food. Flavor enhancers supplements enhances or modify the original taste or aroma of food, and also the flavor enhancement for the older adults and the sick can improve food palatability and acceptance. I think most adults, they always want you to put some bit of flavors in their food for them to enjoy it. So the effect of aging on the smell, so both of the number of fibers in the olfactory bulb along with olfactory receptor decrease noticeably with age. So the bulb losses the secondary to sensory cell loss in the olfactory mucosa along with the general deterioration in the central nervous system, cognition, processing functions. So this, in short, they will be reduced in the sense of smell. The other thing is the Alzheimer's or cognition decline. Okay, once the diminished smell is diagnosed, the goal of management entails preventing injury related to this. Visual stimulation, gas deterioration devices are all this stuff. Effects of aging on the touch. The senses of touch include sensation of pain, temperature, pressure, vibration, body position, skin, muscles, tendon, joint, and internal organ have nerve endings that detects this sensation. Brain receives this information about the position and the condition of internal organs via receptors presenting on the end organ. The signal to send the brain help identify. Okay. All right. So due to time, the reference is from the Physiology, the PPT, and the Physiology Basic of Aging and the Geriatrics. Hope you enjoyed my presentation, and I will see you again.